Welcome to our webinar in Actives to Treat Acne and Rosacea. This webinar follows our cosmetic chemistry webinar. We will look at the particular actives that are useful in the treatment of acne and rosacea. We will focus predominantly on the patient's home care regimen, as this daily routine is incredibly important in assisting with the treatment and long-term maintenance of acne and rosacea. Acne and rosacea are two of the most challenging skin conditions to treat because it involves an immune response and chronic inflammation. Acne vulgaris is much more common than rosacea and appears anywhere from the start of puberty to adult onset. Acne affects both men and women, and one of the most common causes is hormonal fluctuations. Genetics also play a big role. Rosacea is a chronic inflammatory disorder and can be challenging to diagnose, especially in darker skin types. Rosacea has 4 common subtypes, and the selection of active ingredients will depend on the subtype that you are trying to treat. There is a massive internal or systemic influence on the severity of both rosacea and acne, and there is a known link between an unbalanced gut microbiome and both of these skin diseases. It is therefore very important to counsel the patient on the necessity of addressing some of the most common systemic influences. Myself and my partner Riolette have both suffered from either acne or rosacea and have first-hand knowledge on what frustrating skin conditions these can be to treat. We will be focusing on the following topics in this webinar: acne pathogenesis, rosacea pathogenesis, the different grades of acne, subtypes of rosacea, systemic influences, actives to treat acne and rosacea. Acne is a disease of the pilosebaceous unit. Acne most often occurs during puberty, and the initial stages of acne can start as early as age 8 to 10 in its microcomedonal phase. This suggests to us that androgens play a major role in the pathogenesis of acne, as androgens affect the development of the hair follicle and subsequently the sebaceous gland that it is attached to. Acne is most common in the face, the neck, back, chest and shoulders, as this is where the sebaceous glands are most dense. Acne involves 4 stages, which we will discuss in detail later on. Firstly, there's an excess in sebum production. There's a hyperproliferation of epidermal cells, inflammation, and excess bacteria present. Rosacea is a chronic inflammatory skin disease and involves the pilosebaceous unit. It can sometimes mimic acne in certain ways, and this is why they can often be mistaken for one another. Rosacea is exacerbated by a dysfunctional skin barrier function, and the following skin barrier defense systems are usually negatively affected in rosacea sufferers. There's an imbalance in the acid mantle and the skin microbiome. There's an absence of epidermal lipids, increased transepidermal water loss. There's a reduction in glycoaminoglycans in the extracellular matrix. There's a rapid destruction of structural proteins, leading to textural abnormalities due to the destruction of collagen and elastin over time. There is increased inflammation, and this can also lead to edema. There is also excess vascularity, leading to sensitivity and permanent redness in the skin. It's very important to understand how acne starts and progresses, why certain individuals develop acne and others don't, and how we can prevent acne from progressing to stage 4 or 5 with a correct intervention at the right time and in the correct selection of actives in the treatment of these skin diseases at home. Acne starts with the changing levels of androgens circulating in the blood in some individuals. Depending on a genetic predisposition, some younger individuals may develop acne and others not. Microcomedones appear in 80% of children aged 8 to 10 years old. When this happens, we must question whether there is a genetic predisposition, as this will mean the difference whether the microcomedonal stage will continue to progress or not. At this age, a good, gentle cleansing routine must be established to prevent a disruption of the acid mantle, which will disturb our skin's ability to defend itself against harmful microorganisms. Some gentle alpha or beta hydroxy acids must be included to prevent a blockage of the follicle. Microcomedones develop as a result of a slight increase in sebum production and a poorly desquamating keratinocyte. Therefore, if we can keep the pore clear of cellular debris and sebum, we can stop the microcomedones in its track. Make sure at this age that the patient starts developing a proper sun protection routine, as they might start using ingredients that make them photosensitive. Multifunctional products like micellar cleansers with alpha hydroxy acids is very useful, as this means there is less product to use. Moisturizers with gentle ingredients like polyhydroxy acids will work very well to encourage exfoliation in a gentle way. Once there's an increase in sebum levels, acne can progress even further. A plugging in the pilosebaceous follicle combined with excess sebum means that certain commensal bacteria that is normally present on the skin and in the follicle starts proliferating. Propionibacterium or P. acnes are normally present on a healthy skin with an intact acid mantle. They are anaerobic and can survive without oxygen, which means that once they become trapped in the follicle, they will survive for extended periods of time and they will start producing free fatty acid waste products. These free fatty acid waste products are highly comedogenic and inflammatory, and this is what actually speeds up the progression of the grades of acne we see on patients' skin. When the sebaceous gland becomes filled with sebum and the follicle opening is blocked, the wall of the follicle can rupture, which leads to the contents of the sebaceous gland and the free fatty acid waste to spill into the neighboring follicles. This process, along with increased inflammation, causes white blood cells to invade the area, and this is where pustular acne emerges. Once the neighboring follicles start rupturing, it can lead to the formation of nodules and cysts. This can destroy the connective tissue, and along with inflammation that increases the production of protein-digesting enzymes, this leads to the formation of scars. Scarring happens as a result of these protein-digesting enzymes digesting the structural proteins in our extracellular matrix. These proteins include collagen and elastin. If there is a destruction in these proteins, we often see the appearance of deep pitted scars or box scarring in patients. The best way to treat these is to prevent them. As mentioned before, rosacea is an extremely difficult skin condition to treat, partly because it's a chronic inflammatory disorder and the triggers are different in every single person that suffers with the disease, but also because rosacea sufferers have periods of remission in which their skin may look normal. It can be very challenging to diagnose as well. There are 4 common subtypes of rosacea: erythema totalangiectatic rosacea, papulopustular rosacea, which are the 2 most common types, rhinophyma, and ocular rosacea. For the purpose of this webinar, I will only be discussing the first 2 as they can be managed with proper topicals, whereas the other 2 can't. We know that there's a genetic link that contributes to the formation of rosacea as well as a hormonal link. It generally develops only later in life after puberty and can be difficult to diagnose as it masquerades as acne in certain instances. It should therefore be diagnosed by a dermatologist who has the experience to identify and diagnose it. We should never forget that rosacea is a medical condition, and we must recognize that there might come a time when we need medical intervention to successfully manage this challenging disease. All types of rosacea has periods of remission, and we should therefore aim to provide the patient with a long-term plan to maintain barrier function, as this will reduce the number and severity of flare-ups. We must also provide emergency solutions for those periods where the patient has a flare-up. Erythema totalangiectatic rosacea is characterized by permanent vascularity on the cheek area. There is significant irritation and barrier disruption, and it may also involve pain and edema. The solutions we offer a patient must address first and foremost barrier dysfunction. Papulopustular acne is a subtype of rosacea in which there is an infection present, immune response, as well as other symptoms of vascularity, edema, and a disrupted barrier function. It looks very similar to acne, but can often be devoid of microcomedones. It can be addressed in a similar way as we address acne, provided that we are managing the skin's barrier function at all times. There is some evidence that suggests that the following dietary factors influence both acne and rosacea. Excess dairy consumption. Because the milk we drink from cows contains some hormones, this can stimulate an already oily skin into producing more oil. Excessive intake of high glycemic index foods, which can potentially worsen existing acne and rosacea. This includes refined carbohydrates and an excess intake of sugar. Unbalanced gut microbiome. There are a lot of studies that prove that an inflamed and compromised gut system will exacerbate the symptoms of both acne and rosacea. There are many factors to consider in patients that have chronic digestive disorders, and we will be covering this topic in greater detail in a separate webinar. Essential fatty acid deficiency, which is quite common in most people, reduces epidermal lipids and skin barrier function. We must ensure that we recommend a good liquid probiotic that is naturally fermented to ensure adequate bioavailability to the gut. We must ensure that we recommend a good omega-3 essential fatty acid. This will aid in reducing inflammation and improve the production of epidermal lipids. The successful treatment of acne will involve, firstly, identifying the grade of acne. On your screen, you will see an accurate depiction of the pathogenesis of acne lesions. Microcomedones is a hyperkeratinization disorder and can therefore be treated successfully by improving the hydration levels of the skin, which will encourage our own natural desquamation. We also need to ensure that they are utilizing exfoliating ingredients in their moisturizer, in their serum, and also in their cleansing routine to reduce the hyperkeratolytic plug. It's important that they are diligent with their exfoliating ingredients because this hyperkeratolytic plug can be very challenging to get rid of. Once the acne lesions have graduated to papules, the papules have both a hyperkeratolytic plug and a combination of trapped sebum and debris. Therefore, a combination of exfoliating actives as well as ingredients that reduces sebum will be necessary. Once these papules turn into pustules, which is a result of the proliferation of bacteria within the follicle and the triggering of immune responses, which causes inflammation, we must include exfoliating actives to get rid of that hyperkeratolytic plug. We must reduce the amount of sebum that is produced. We must reduce the inflammation by including anti-inflammatory actives in our routine. And we must also get rid of the bacteria, so we have to include antibacterial topicals. You can see now that the more that the acne progresses and the more clinical symptoms of acne that we see on the patient's skin, the more detailed our skincare regimen needs to become, because we have to include so many different types of actives to target each of the stages of the pathogenesis of acne. We must ensure that we are including actives with multifunctional benefits so that the patient doesn't wind up using too many products in her home care regimen. Once the acne has progressed to nodular or cystic acne, systemic intervention with oral contraceptives or low-dose Roaccutane might be needed to prevent the follicle wall from rupturing, which will cause scarring in the skin. If it is a darker skin type with post-inflammatory hyperpigmentation, we must include some tyrosinase inhibitors and perhaps ensure that the other actives we choose also possess some skin lightening benefits. For instance, when choosing an alpha hydroxy acid for the patient, we can choose an alpha hydroxy acid that also has a skin lightening benefit, like mandelic acid. If the patient is on a low-dose Accutane or there's a risk of scarring, peptides and amino acids in the patient's routine will reinforce the extracellular matrix components, and this will prevent scarring from occurring or worsening by reinforcing the structural proteins in our skin that support the dermis and prevent textural abnormalities with acne and rosacea. Let's take a look at each step in the pathogenesis of acne. How would we choose active ingredients according to the grade of acne and the type of lesions that we see on the skin? Use this as your guideline when choosing your basket of ingredients that is necessary to formulate a successful treatment plan. Firstly, retinol can be used in the long run, and although it might cause some sensitivity in the short term, it will alleviate many of the symptoms of acne, including improving the natural moisturizing factors in the long run and reducing sebum, but also thinning the viscosity of the sebum to avoid a plugging of the follicle. It will lighten dark blemishes and reduce the chance of scarring by increasing the structural proteins in the dermis so that we can strengthen the extracellular matrix. Tretinoin should be reserved for short-term use and for spot treatments in patients with a damaged barrier function. It can be used as an emergency measure to alleviate the symptoms quickly before starting on a course of retinol, which can be used in the long run. Lactic and glycolic acid is great for patients that have adult onset acne, as it will alleviate some aging concerns as well. Mandelic acid is an excellent choice for darker skin due to its skin lightening benefits, and it will also improve the tolerance of the skin so that they can tolerate salicylic acid better when it's introduced into their routine. Salicylic acid is the gold standard ingredient for the hyperkeratolytic plug that we see in acne because its lipophilic nature means that it can penetrate the pilosebaceous unit to deeply treat the clinical symptoms of acne. Lactobionic acid is a polyhydroxy acid which can be used in patients with a severely compromised barrier that might not be able to tolerate alpha-hydroxy acids. All of the actives that we've discussed on this slide is particularly geared towards treating the specific symptom of acne, which is the hyperproliferation of epidermal cells, which essentially causes that plug in the follicle wall. Remember that if this plug is not there, then we will not get an accumulation of bacteria and an increased amount of sebum that becomes trapped in the follicle, leading to the progression of a microcomedone, which then eventually turns into a papule or a pustule or a nodule cyst. So it's important to target this step in the pathogenesis of acne accurately by choosing a exfoliating active that suits the individual needs of that patient, which is determined by the state of her barrier function, but also the grade of acne that she presents with. Let's take a look at the second stage of the pathogenesis of acne and how we will treat this stage with particular actives. It's important to understand that there are various reasons why an individual develops acne that is beyond our control. Genetics, hormonal fluctuations, disease, and certain medications can all contribute to the formation of acne, and it can be very difficult to treat successfully if we don't address the underlying cause first. Excess sebum production along with a blocking of the follicle becomes a problematic concern because it traps anaerobic P. acnes inside the follicle, and these P. acnes actually feed on sebum as a source of nutrition. This will exacerbate inflammation and lead to infection in the skin. The following ingredients reduce sebum in the following mechanisms. Retinoids. Topical retinoids bind to the sebocyte retinoid receptors, reducing sebum production. It also loosens the keratolytic plug within the follicle, ensuring that sebum moves out of the sebaceous gland quickly and effectively. EGCG, which is the active ingredient in green tea, has shown some promising results and studies. Studies indicate that 3% EGCG will significantly reduce sebum output. Salicylic acid decreases sebocyte lipogenesis and reduces inflammation according to studies. Benzoyl peroxide reduces excess sebum and reduces the adherence of epidermal cells within the pilosebaceous follicle, which can prevent the blocking of that follicle. Oral contraceptives are effective in regulating androgens, which are responsible for regulating hair growth and sebaceous gland development. If the patient has hormonally mediated acne, the contraceptive pill will reduce the severity and the number of lesions, but should always be combined with a good sunscreen and topical skincare approach. Systemic retinoids have a permanent solution on the size and activity of the sebaceous gland. It does create significant uncomfortable side effects, and high doses are not necessarily more effective than a low dose combined with a topical skincare approach. The proliferation of excess harmful bacteria is obviously a very important point to address during the treatment of acne. Maintaining a healthy acid mantle will ensure that our best natural defense mechanism against harmful bacteria and microorganisms is kept intact. This is our microbiome, or layer of commensal bacteria that is on the skin. Always encourage the patient to stay away from alcohol-based cleansers and toners that strip the skin of its beneficial lipids and create an alkaline pH. Mandelic acid not only inhibits tyrosinase and encourages exfoliation, but also has fantastic bacteriostatic benefits. Benzoyl peroxide kills bacteria, and although it is extremely effective in reducing bacteria and inflammation, it should not be used continuously for longer than 6 weeks, as it can create antibiotic resistance. It does work extremely well and fast, so it is a great solution for pustular acne, but it does create significant dryness and sensitivity on the skin. This is thankfully short-lived, and the benefits outweigh the risks in most cases. Azelaic acid has excellent antimicrobial and anti-inflammatory effects and the added benefit of being a fantastic skin lightener. The active ingredient EGCG, which is derived from green tea, is also fantastic at reducing harmful bacteria in the skin and improving the microbiome and the acid mantle to prevent future unbalanced microbiome levels. All of the actives mentioned in previous slides and mentioned on the screen has amazing anti-inflammatory benefits. One can also recommend an essential fatty acid supplement for patients with acne and rosacea, as this improves the production of epidermal lipids and reduces inflammation in the body. The essential fatty acid that is most recommended for acne is omega-3 derived from a marine source. Unlike in menopausal women that need essential fatty acid, which is derived from evening primrose oil, krill oil or salmon oil derivatives work better for acne and rosacea according to the studies we've researched. CBD is also a novel, new and exciting topical ingredient that speeds up skin barrier restoration significantly. It also reduces inflammation, pain and redness associated with these skin conditions. Centella asiatica is an oldie but still a favorite because it encourages healing of the skin and reduces the sensitivity experienced in these skin conditions. As mentioned before, rosacea involves the pilosebaceous unit, and many of the same clinical features that appears in rosacea also appear in acne, and it can be difficult to distinguish the difference between them. There is chronic inflammation present with rosacea and also a chronic disruption in skin barrier function. There's also often edema present as a result of the vascular symptoms associated with rosacea, and due to the fact that it has many systemic triggers, it can be very challenging to treat successfully. Treatment often involves limiting the number of flare-ups by identifying the most common triggers and maintaining a healthy barrier function to reduce the severity of those flare-ups. Let's take a look at some of the actives that can reduce the amount and the severity of rosacea flare-ups. Melilot is an excellent ingredient and is often used in lipolytic injections for its draining effect. It is also used in topical skincare and can be used to benefit rosacea by reducing the amount of edema associated with some subtypes of rosacea. The polyphenols found in green tea, and specifically EGCG, exert the most influence on rosacea with antioxidant, anti-inflammatory, anti-carcinogenic, and antimicrobial properties. Of the 4 common catechins found in green tea, EGCG is the most pharmacologically potent. It acts as a preventative agent for telangiectasia, and it also has fantastic antioxidant and immunomodulatory functions. CBD will reduce redness and reinforce the skin's natural defense mechanisms in the upper layers of the epidermis. It is highly anti-inflammatory and antibacterial, and therefore a great topical for rosacea. Azelaic acid has shown incredible benefits to rosacea sufferers due to its antimicrobial and anti-inflammatory benefits. Retinoid derivatives might be more tolerable than your standard retinol or tretinoin for rosacea, as these patients tend to be highly reactive to the more pure forms of vitamin A. These retinoid derivatives can still improve extracellular matrix components and prevent textural abnormalities associated with rosacea. Hypochlorous solutions, which are sprayed onto the skin during flare-ups, may reduce the pustular eruptions associated with acne, and it will also speed up healing by reducing inflammation. A low dose of sporadic Accutane taken in the long run has proven to be very effective in managing the clinical symptoms of rosacea, but also the severity of flare-ups. Thank you so much for joining us on this interesting topic that we've hosted in this webinar. Make sure to listen to our other 2 webinars on cosmetic chemistry. And if you love this topic, inquire about our upcoming cosmetic chemistry masterclass, which is coming soon. Make sure to leave your comments below if you've got any specific questions on actives that you are currently working with, or actives that you hope to work with in the future to treat this condition. Make sure to follow us on social media at SkinSkillsSA and follow us on our website, skinskills.co, to inquire about our other online courses that we offer.